Knock knock.
Come in.
Hi, Mrs. Jones.
Yes.
Good morning. My name is Jovanny. I'm going to be your nurse today. I'm going to go ahead and check the orders today just to see what we have to do today, okay? Alright, I'm going to go ahead and perform hand hygiene. Actually, before I start, I do want to confirm your first and last name, okay? Is that okay if I borrow your wristband just to double check?
Yes.
Okay. Can I get your first name, please?
Mrs.
Last name?
Jones.
And your full date of birth?
October something something.
Alright, perfect. Let's check the orders. Alright, Mrs. Jones, I see on the computer that you have a urinary catheter order for today. Okay, so what this means is we're going to place a tube into your bladder that's going to help relieve some of that pain or some of that discomfort that's in there, some of the fluid on the urine. We're going to allow that to come out, okay, with this tube. Alright, so before we get started, I do want to go over your allergy list. I just want to know if you're allergic to latex.
No.
Are you allergic to betadine?
No.
Are you allergic to shellfish?
No.
Okay, great. So I'm going to go ahead and get started by gathering my materials, okay?
Okay.
I'll be back. From hand hygiene. Knock knock.
Come in.
It's me. So I'm going to go ahead and get started, okay? I'm going to set up. I do need to go ahead and perform peri-care before we get started with the procedure, okay? And so, hand hygiene. So I'm going to have to clean your genital area, okay? Let's go ahead and do that. So I'm going to go ahead and raise the blanket up. And then, so peri-care, we're going to get a washcloth, we're going to get a basin, or just the wipes, and we're going to go ahead and clean the area. Once you're finished cleaning the area, you can put our sheet back on, so you just can give her some privacy, okay? So let's go ahead and do that. We'll finish peri-care. Get rid of your materials. You want to wash your hands, hand hygiene, okay? And so let's go ahead and gather your materials at this point. Get started with the catheter part of it. And so you actually want to get the patient in the proper position. And so you can actually get that done now. All right. So let's go ahead and, Mrs. Jones, I'm going to go ahead and put you in the proper position to get this catheter inserted, okay? So let's go ahead and do that. So you want to expose her genitalia area. All right. And then if it's cold, you can get a blanket and put on her feet. You want to put her in the lateral recumbent position here, and you want enough space in the middle so you can put your materials there. You want to go ahead and look, gather your materials, and you want to look at what size. So it's a 4-seam French latex catheter, and this is a pre-filled syringe. It's 5 cc's to 10 cc's. So this is proper for the patient. And you want to go ahead and take the plastic off, rip the plastic off to the top. You want to go ahead and put this where the patient's at, roll it up if you want, so you can put your cotton in there and some of your trash. You can throw this away. And now you're going to go ahead and open this sterile packaging. Nice and easy. Remember, you get a 1-inch border to work with, but you don't want to put your hands under the table, and you don't want to go over everything. So you can actually turn and just grab what you need and open. Just like that, hold it down. Okay, great. So you want to go ahead and grab this first one here. Okay. You want to step away from the table and let it drop. You want the shiny side down. So make sure you hold on. You're going to go ahead and put this with the shiny side down right underneath her right there. Okay. Now you got your sterile gloves. You're going to put your sterile gloves right here on the side. Okay, cuff down. And I'm actually going to use another piece. You gotta be nice and careful though for what you're doing. I do want a little bit of extra space since this is sterile. I can use this to put some of my materials just in case I need a little bit more room. Okay, so now at this point, you can actually, let's just put our gloves on at this point. So again, you get a 1-inch border for the sterile gloves. You don't want to put your hands under, you want to keep your hands up. With your non-dominant hand, you want to grab the glove. Make sure you get the right size for glove. Make sure you test it out before you do this. Okay. Then you want to tuck your hand in under, just like that. And you can start to put your hand in there. Again, if it's obviously the wrong side, you can organize it. So you can actually make it work. Can be a little bit of a challenge, but now that your gloves are on, everything is sterile. This is actually giving me a really, really hard time, so. Alright, great. There we go, look at that. Managed to get it on somehow. Okay, great. You fix your gloves. Throw this away. You can fix your sterile field. You want to get a little bit organized. Think about what you need. Hydrogen peroxide, she's not allergic to betadine, so you don't really need that. You can leave it here on the side. You can already open up your fluid of betadine, put that all around the cotton balls, drench it on there. You can put that aside. Get your lubricant, open that up, put it on one of the sides. You probably take your tongs, put it all in that area so that you know you're gonna have to put your catheter in there. So you want to set it up so you can do so. I'm gonna leave that in just so I know. Now you're gonna get your syringe. You can actually already put your syringe on. And you can actually leave it there. You can leave this on your sterile field. It's just a urine cup. Yeah, let's go ahead and take off so for this you gotta be real careful. You gotta make sure that you keep everything in a sterile field. You don't want anything to fall out. You wanna make sure that this is very flimsy, so you wanna make sure that you be careful. You can throw this away in the trash. Okay, we got our materials that we need. Now you're gonna put this stuff back on. You're gonna come over here. Make sure you have your sterile field open. Put your box right there. Right in the middle, right in the sterile area. You can put this right there since it's sterile as well. Alright, so now you ask the patient, how are you doing? Are you doing okay? Everything okay so far?
Mm-hmm.
Okay, great. So now you're gonna wanna, with your non-dominant hand, you wanna go ahead and open up the labia. Okay, you wanna hold that there. Now you wanna go ahead and grab, actually, you don't wanna do this yet. Okay, you want to go ahead and clean the area. Don't forget to clean the area. That's very important. You're going to grab a cotton ball with a tong, and you're going to clean from the top, the whole side. Okay, that's one. You're going to throw that in the trash, okay? Now you're going to get another one that's drenched. Make sure it's drenched, you know? Alright, clean the opposite side of the labia. Throw that away. Now you're gonna grab another drenched one and you're gonna go right down the middle. Okay? Now you're gonna put that away. You don't need your tongs anymore. You're still holding on with your non-dominant hand. So now you're gonna grab your catheter and you're gonna look for the urethra and you're gonna go ahead and hold 2 to 3 inches back. Before you go in, then you wanna go ahead and lubricate. So you wanna go ahead and get in there, get the lubricate all over it, about 2 to 3 inches. Alright? For a male, it's gonna be about 6 to 7 inches, as much as you can. But for now, we're doing 2 to 3. So you wanna go ahead and go into the urethra. Okay? You wanna go ahead and go nice and slow. Once you get flashback, let's go ahead and go another 2 or 3 inches. Okay, just a little bit. You don't have to go too far, about 2 inches. All right, great. So now you're gonna go ahead and scoop back with your right hand, with your sterile hand. You're gonna let go of the labia. You're gonna hold on a little, like about 2 inches down, with your non-dominant hand, or with your non-sterile hand. You're gonna go ahead and put in the solution. You don't want to go so fast. You want to go nice and moderate. Okay. Once that's done, let's go ahead and take off the tube. You can actually throw it away or put it to the side. And at this point, you're gonna go ahead and pull until you feel tension because of the bulb. Okay, you feel some tension now, right? And now at this point, you're gonna want to go ahead and go back just a little bit. Okay, now, so it's not irritating the neck of the bladder. All right, that looks great. So now our procedure is done. And we're gonna go ahead and grab our bag. You want to unwind it a little bit because you don't want it to kink. Okay, you want to put it on the bed frame. Okay, not on the side rail. All right, so that's there. And you can actually clip this part right here to the bedding. Okay. And then with this piece here, you want to have a stat lock right on the medial side of the patient's thigh. Stick it on there. Clean it with some alcohol wipe before. Stick it on there. And then you're gonna clip it on, so that's gonna stay right there on the medial side. And once that's set, you can go ahead and clean your things. Make sure you grab everything. You want to wrap everything up, get rid of it. You can even take off your gloves. She's gonna be just sitting there. You can perform hand hygiene quickly. Get her in a comfortable position. Get rid of the trash. Make sure you look around and see all the trash. You want to go ahead and put her in a comfortable position. You want to go ahead and put the bed on the lowest position. You want to go ahead and put her call light right there where she can reach it. You can ask her if she's having any discomfort at this point. You can ask her if she has any questions. You can ask her if she needs anything at this point. And just make sure there's no kinks. Other than that, you can say goodbye, go ahead and document, and that's it for catheterization.
Thank you, Doc. Or nurse.